Hi there, this is Dr. John Carrozzella from the Florida Center for Hormones and Wellness. And I want to talk to you just a little bit about a question that I get all of the time. Doctor, am I too old to start hormone therapy? Well, you know what? That would sound like a question that might be reasonable because there's so many other medicines that have age limitations for this, that, or the other. But I'm going to tell you one thing. There is no time that is too late to start hormone therapy to improve your life, vitality, your function, your activity level, your sexuality. There is no time at all at which it is too late. Now, I will tell you that when you look at the synthetic hormones that used to be the rage back in the late 1990s and the early 2000s, there absolutely was what they called a window of opportunity, meaning that you needed to start your hormone therapy between the age of 50 and 60 or within the first 10 years of menopause in order to get the best result. Now, it's really technical and really complicated as to why, but that is not exactly the way that it is when you're talking about the biologically identical hormones. That is, the biologically identical hormones are distinctly different than the synthetics, and the synthetics carried with them a significant risk of developing some problems that occurred at a point about 10 years after menopause. We do not see that with the hormones that we use that are biologically identical. In specific, estrogen, or estradiol more specifically, is a hormone that everybody seems to be afraid about. That's the one that everybody said causes breast cancer, blood clots, and all kind of horrible things. The reality is when you differentiate estradiol from the Premarin and the other synthetic estrogens, from day one, estradiol is beneficial no matter how old that you are. Estradiol immediately begins to repair your physiology, lower your blood sugar, improve your cholesterol. It improves your vitality, your overall sexual health, your vaginal health. It improves your brain health, your bone health. It reduces your risk of heart disease. And in so many ways, it is beneficial for you. And it does so in a very benign, very physiological, and very normal way. As opposed to Premarin, which when you start Premarin, it increases your inflammation for a year or two and then it declines. And so what we saw is when people are on the synthetics, this increase in inflammation for the first year or two led to some serious problems that led people to say that you could not start your hormones after you were 10 years into menopause. Well, the fact of the matter is, immediately upon starting the biologically identical estradiol, testosterone, and progesterone, the quality of life improves. Your menopausal symptoms go down. You feel more vibrant, more vital, more active. It's amazing the difference that people see. And I can't tell you how many times that I see people in this office that say that starting hormones was life-changing to them. I think of one patient in particular. Her name is Linda, and she started here as she was 80 years old. And she was afraid to come in because she thought that she was too old. Well, I'll tell you what, when I spoke to that young lady, she was vibrant and vital at heart. She just didn't feel very good. She was run down. She actually had a boyfriend and she was dating, but they didn't feel like having any intimate time together. And she came in and said, everybody tells me that I'm too old, but I have a feeling you may be able to help educate me as to what's going on. Well, I sat down with Linda and we had a nice conversation of the pros and cons and risks and benefits of hormone therapy. And you know what? She decided to give it a try. Within 6 months, she was sitting here in the office saying, my brain is sharper, I can think more clearly, I feel more vital, I feel more active, and she started to become more and more sexually active. At 80 years old, it is remarkable. I'm going to tell you what, God gave us this precious gift of intimacy. And we get to reactivate that even as when you're in your 80s or 90s or even more. It's a wonderful thing to be able to share your body with somebody else and experience that joy and pleasure that comes along with that. And that was something exactly that Linda did. Not only that, when she got her bone scan 2 years later, it started to show that her bone density was improving. All in all, we were able to get her back on her hormones, get her healthy and vital. So, summing it all up, is it too late to start hormones? By all means, it is not. You can start biologically identical hormones at any age and get a great result. Now, the earlier you start it, the better health and long-term protection you get. But when you take that aging process that's going like this and you start on hormone therapy and you slow that down, and in fact, in many cases, start to feel better, it's dramatic and it is life-changing. So I would encourage you all, if you feel that you're hormonally insufficient or hormonally imbalanced, no matter what your age, give us a call, give somebody a call, give a professional a call who does hormones at an excellent top-notch level, and you will find that they can help you too. This is Dr. John Carrozzella from the Florida Center for Hormones and Wellness.